Zimbabwe is a developing country located in southeastern Africa, bordering South Africa, Botswana, Mozambique, Namibia, and Zambia. Zimbabwe is broken up into 8 subdivisions and 2 cities with provincial status. One of those cities is the capital, Harare, which is also the most populated city in the country, holding just over 2.1 million people. The official language of Zimbabwe is English, although there are many local dialects spoken, the most prominent of which is Shona. Our group, Hutano, will be focused on the health issues that plague Zimbabwe. Hutano is a Shona word meaning the state of being hale, sound, or whole in body, mind, or soul, and that represents the goal for Hutano for the people of Zimbabwe. Hutano is an independent nonprofit NGO that seeks to improve the health of disadvantaged Zimbabweans by focusing its efforts on one area, HIV and AIDS prevention. To date, Zimbabwe has the 5th highest HIV prevalence in sub-Saharan Africa, with 15% of the population affected. As of 2015, 1.4 million people were living with HIV in Zimbabwe, a country with a total population of just 15.6 million people. HIV is prevalent in 14.7% of the country's total adult population, and there were 64,000 new infections in 2015 and almost 30,000 AIDS-related deaths that same year. Additionally, particular groups of people are at greater risk for HIV infection, notably women and children. 720,000 women are affected with HIV, 70,000 of whom are pregnant. This causes serious issues for children in Zimbabwe who contract HIV or contract an infectious disease from their parents who have weakened immune systems as a result of suffering from AIDS or HIV. Consequently, the infant mortality rate, which, while it has fallen, is still at a staggering 46 deaths per 1,000 births, which is more than quadruple the U.S. rate of just 6 deaths per 1,000 births. Starting in the capital, Harare, Hutano aims to reduce HIV and AIDS prevalence through a 3-pronged approach. First, Hutano will provide training in local schools to emphasize the importance of condom use and will aim to better educate the youth of Zimbabwe on sex education. Second, Hutano will provide free or subsidized low-cost antiviral drugs for those who already have HIV and AIDS. Third, Hutano will set up free healthcare clinics targeting young women, children, and pregnant mothers, as they are some of the groups most vulnerable to HIV and AIDS. Hutano's first task is to find teachers that can teach sex education to the youth of Zimbabwe as a preventative measure against future HIV and AIDS outbreaks. These teachers would follow curriculum that emphasizes condom usage alongside other common birth control methods such as the pill, abstinence, and delayed sexual activity. The curriculum would also include educating youth on protecting themselves from sexual violence and coercion, as well as sexually transmitted infections. As there is currently a shortage of trained personnel and teachers in Zimbabwe for sex education, Hutano would rely on paid workers or volunteers drawn from international organizations such as AmeriCares or the Peace Corps to fill gaps in staffing until local teachers can be brought onto this curriculum. Hutano is willing to pay the cost of sex education training for local teachers. They will have to pass a certification test at the end of a 6-month program, but once they do, they will have a guaranteed job for at least 4 years. As an additional incentive, Hutano will also provide low-cost healthcare to local teachers who sign on to this program. Hutano acknowledges that there are some risks involved, one of which is infectious diseases for the temporary international teachers. To mitigate this risk, we will do our utmost to screen out teachers with existing health conditions and require regular vaccinations and checkups for those who do go abroad. After setting up sex education for youth in schools in Harare, Hutano's next initiative is to provide free or subsidized low-cost antiretrovirals for those who already have HIV or are suffering from AIDS. This program is primarily meant to be a stopgap measure to ease the pain for people who are already suffering from an advanced stage of the virus, and will prioritize treatment for pregnant mothers, young women, and children. However, it will provide treatment for all who ask. Hutano will emphasize working directly with hospitals and clinics to minimize the risk of corruption and graft or embezzlement to the greatest possible degree. However, Hutano does acknowledge that it will still need to go through the Zimbabwean government for permission to distribute or sell antiretrovirals in the country. Finally, Hutano will set up low-cost health clinics in particularly poor areas of Harare to provide on-site health care for young women, children, and pregnant women. Hutano will focus on renovating existing shutdown clinics in Zimbabwe to save money. We will obtain permits from the government to begin construction, ensure that the facilities are clean and have access to electricity and water, and hire the necessary construction workers. Once these clinics are renovated, Hutano will hire appropriate hospital staff, but as with the teachers, to run the facilities temporarily, Hutano will hire or draw from existing international organizations such as Doctors of the World and Doctors Without Borders, and these healthcare professionals will help provide care and training, especially for midwives and nurses in the area. These healthcare clinics will provide common birth control methods, test for HIV and AIDS, provide prenatal care for women suffering from HIV to prevent mother-child transmission of the disease, and also help manage opportunistic diseases and viruses that come from having HIV and AIDS. This is a problem especially prevalent in young children suffering from HIV as well as other infectious diseases. While there are some security concerns about having these clinics in the poorest or most impoverished neighborhoods of Harare, Hutano will attempt to provide the best possible security for the clinics. As a result of this plan, Hutano hopes to continue to push Zimbabwe towards an HIV-free future. We aim for an increase in the percentage of young adults being taught effective sex education, especially with regards to HIV and AIDS, and we are also aiming for a decrease in the maternal and infant mortality rates in the city of Harare. As you can see here, we have allocated our billion-dollar budget to the following areas: 5% for security at sites, 30% for operating costs of schools, 40% for operating costs of the health clinics, 10% for the construction costs of those clinics, and 15% for the antiretroviral drugs as well as the delivery of said drugs. Additionally, by reducing HIV prevalence in Harare, Hutano will also be decreasing subsequent health costs that come from treating opportunistic diseases and viruses that attack the weakened immune systems of HIV sufferers, saving hundreds of thousands, if not millions, in future healthcare costs. By pushing for better sex education in schools, by providing low-cost antiretroviral drugs, and by providing and establishing healthcare clinics for women and children in Harare, Hutano hopes to give every woman the ability to deliver a healthy, HIV-free child and to further promote the importance of preventative sex education amongst young adults in Zimbabwe.